A very good evening on this 18th day of April 2024. Welcome aboard. I am Sunday Gloria Aboch with Uctv News. And now the Archbishop of Kampala, His Grace Paul Semogerere, has proposed that government considers paying medical doctors working in private health facilities because they also serve the public and complement government efforts. Archbishop Semogerere made these remarks after officially opening the new Mother Mary Kevin ward at St. Francis Hospital in Zambia earlier today.
The event preceded a Thanksgiving Mass held at St. Francis Chapel within the hospital, after which the Archbishop went and officially opened Mother Mary Kevin Wing, a medical facility that has consumed about 15 billion Ghana shillings, in addition to 3 billion spent in equipping the facility with modern technology medical apparatus. Shortly after the official opening, the Archbishop made a tour of the 7-story building, upon which he appealed to the government to consider enrolling medical workers from religious-based institutions on the public service payroll.
Awo government yalibadde eyamba okusooka n'eyambako okulaba nga ekulaakulanya amalwaliro gano okuddukira mu ddagala bwe twetagisiza okujja twebaza emirundi egimu gye bajja ne batuyambako okutwa eddagala erinaatuyambako oyamba bulwadde nga bayiseeko wano naye ate ekisingako n'okusasula abasawo bakola bulungi beevaamu nabo bandyagadde okubeera obulungi singa gavumenti eyambako netuwa ku ssente kusasula abasawo bannaasi ne badokita abajjanjaba mu kitundu kino kyandikoze bulungi nnyo kuba bonna bajjanjaba ggwanga lya Katonda.
The Member of Parliament for Machinje West, Alan Sewanya, added his voice on the Archbishop's call for the government to emulate and extend such medical facilities like Mother Mary Kevin Wing to all parts of the country.
This is a facility which is well equipped with everything, at least medically, which can assist each and every Ugandan, especially those who have been yearning for treatment from outside Uganda, can enjoy such a facility. And this, we are safe health-wise. But I also pray and ask the government of Uganda to equip each and every region at least with such a facility, because if you have such facilities in each and every region, that means that the health security of these Ugandans will be very safe, and that is how countries grow and how countries develop. And the minds of Ugandans will be safe, thinking that they are safe with better medical facilities. Recently, the Speaker of Parliament visited this facility and applauded it when Honorable Seginya Muhammad was being treated from here. And even today, the Archbishop has applauded the facility. And also us as leaders, we are very glad that this is a facility which is in our area. We pray to God that such a facility is extended to each and every region of this country.
The CEO of St. Francis Hospital, Dr. Andrew Sachitoleko, highlighted on the benefits and achievements of the new facility towards the community.
A number of people who have been considering going outside Uganda have actually chosen now to use this facility as one of the facilities. It has allowed us to attract some business which in the past we were not even able to attract. In other words, remember the building is set up to subsidize care for the general patient. So that we're seeing very good utilization. As a matter of fact, when we opened it up, we were almost full to brim. You know, the occupancy was very high. And the second achievement has been the training, that the building is modern, so it has allowed us to train our postgraduate students, our interns, using some modern facilities which they may not be able to meet in any other facility.
Joseph Kabale, UCTV News.
St. Francis Hospital in Zambia annual open medical camp has attracted thousands of people seeking free medical services. Many beneficiaries applauded the hospital administration for the free medical services offered in the departments of pediatrics, radiology, pharmacy, and the eye clinic.
The Nsambya Annual Open Day Camp is a free access medical camp held at St. Francis Hospital in Nsambya every year, where even the less privileged members of the public are at liberty to access medical services. Christine Kamahoro, a nurse at this hospital, highlighted on some of the medical services provided on such a day.
We have emergency services where the very sick, accident and emergency cases come, and then we offer a service to them. We have obstetrics and gynecology that cater for mothers who are pregnant and non-pregnant mothers. We have surgical cases, those ones who need to be operated and those who don't need to be operated but have surgical issues. We also have the medical cases, patients who are having like diabetes, like pressure, all those diseases. We also offer dental services in Nsambya Hospital. We have services in the eye clinic. We also have pediatric, because we also have children, we offer services too. We also have radiology department where we have patients who need to be scanned, have services given to them.
In an engagement with these beneficiaries, they applaud the hospital administration for the opportunity extended to less privileged to enjoy the medical services they would not have afforded.
I thank Zambia Hospital to help us. He has given us life. Some people we can't manage ourselves, but it has done it. It is for free, and you have got everything as per now. If you hear again this message, please come and join them. They give help, they help, and they serve good service. They have done it. I have been sick. They have given me the results. They have given me the medicine. Each and everything which I needed, I have got it.
I came for a normal testing and screening at Zambia Hospital. Everything has been free. I tested for a list of random blood tests for sugar, malaria, HIV, hepatitis B. I even did a scan for some diseases. So at the end of the day, everything has been fine. The nurses and the doctors, they have been wonderful for today. So I have not seen any challenge.
Joseph Kabale, UCTV News.
Now, hemophilia is a rare disorder in which the blood doesn't clot in the typical way because it doesn't have enough blood clotting proteins. Yesterday, the world celebrated Hemophilia Day. The Executive Director, Hemophilia Foundation of Uganda, Agnes Kisache, called for government support to create more awareness about this disease. All of this happened at Mulago Hospital grounds in Kampala, as our reporter Nora Osinde was there and now brings us the details.
Peter Nagulu, a 29-year-old man who hails from Buteleja, suffers from hemophilia. Hemophilia is an inherited bleeding disorder in which the blood does not clot properly. Peter says that he only got to know about his disease 8 years back as an adult. Before that, his family believed in witchcraft and all sorts of superstitions. Growing up with the disease has been a very challenging experience because the disease comes along with bleeding within joints that can lead to chronic joint disease and pain. He tells us how the disease got him bedridden and slowed down his physical development.
I stayed on bed for 2 years when I could not do anything for myself. But at the age of 4 years, I started walking again, thank God. Actually, they just prayed for me to walk again at the age of 4 years. But this condition kept on torturing me. You could wake up in the morning when the hand is swollen, when the leg is swollen, yet you didn't do anything, or like you didn't get any accident. Like when you get a cut, you bleed longer than a normal person. We tried to move to different hospitals, but we never got the cause for that.
Besides being bedridden for a long time after minor injuries, he says that at school fellow students were usually unkind to him. There was a lot of teasing as students mimicked his walk due to the joint problems he had because of the disease.
I was tortured psychologically in the way that kids could describe the way I walk. They could tease me the way I walk, so because I was not walking normally. But I knew why I went to school. I had to continue studying because I knew that the moment I studied and I finished education, that could be the only way I could survive in the world.
One of the challenging times during his school time is when he had to sit on the roadside for hours to find a good Samaritan to carry him to school.
I joined high school. The place was very far, about 5 kilometers from home. I could sit along the way to beg for someone to take me to school every day, and I do that in the evening.
Peter is among the people struggling with hemophilia. The world is celebrating the International Hemophilia Day. A call to raise awareness of the disease has been made by Agnes Chisachi, the Executive Director, Hemophilia Foundation of Uganda. According to her, there are so many people who carry the disease and called on government for support and intervention.
Why do we do this awareness? We have realized that the number of patients is quite big, because we are looking at the prevalence of one in 5,000 births. So we expect to have over 4,600 patients in Uganda looking at our population, but how many have been identified? So as a foundation that supports this community, we have only 7% who have been identified. It means almost 93% is there. Patients are suffering, others have died, others are crippling, others are disabled, name it. So how can we support this community? How do we support this population? Is by identifying them and referring them to the right services.
Dr. Phil from Lago says currently only 400 out of 5,000 have been diagnosed in global estimates. The disease mostly affects males, yet the females are the dominant carriers of the genes.
It means we have a lot of work to do as health workers and as a community to link all people with abnormal bleeding, and especially the boy child, because hemophilia is basically a genetic condition. The affected patients are born with it, and it mainly affects the male child.
This, as he explains some of the symptoms of the disease, which includes excessive bleeding. He also cautions fellow health workers to be keen to examine the disease.
Apart from bleeding for longer times, imagine a boy has been taken for circumcision, and then what looked like a simple circumcision process ends up requiring admission because he has continued to bleed for a longer time. You need to suspect a bleeding disorder. A child has gone for a dental for a tooth extraction, and then what looks like a simple tooth extraction leads to probably admission and transfusion because of severe blood loss. Others may include, like for example, a child has gone for immunization, they inject, and then at the injection site it swells and darkens. That will make you suspect bleeding, uncontrolled bleeding at the injection site.
To Peter, the disease has not only affected his work life, but also his love life. Most often, he's afraid to approach potential partners due to the stigma.
It has affected my work life so hard, to the extent that I've resigned from several jobs when I could no longer manage the pressure and the movements from one place to another. So you find that you rather stay home than working today and staying home for weeks. No boss can accept that. So it has affected me so much. And relationship-wise, yeah, it does, because you feel stigmatized. You know sometimes you fear to approach, and like when you're in a relationship, still, you know, in the process of providing, you find that you can't provide a lot for the in the relationship, and you find that you fear to start the family with the condition, and asking yourself whether you manage it.
He says the government needs to do more to sensitize the public about the disease.
I wish the government gets involved in this condition. We shall be seen, or we shall be also prioritized like other Ugandans. So the government to support us.
Nora Osende, UCTV News.
And finally, from the local scene, the State Minister of ICT and National Guidance, Godfrey Kabyanga, has appealed to the population to cooperate with the census enumerators and supervisors as preparations for the National Population and Housing Census is planned for the 10th to the 19th of May 2024. This will be the first ever paperless census to ever happen in Uganda.
So for us government to conduct a population census, it is for planning purposes, so that the population can be planned for. We need to know the demographic structures that we have. The youth more than the old people, or the old people's population has increased. All those are things which we need to understand. The major indicator of that, the measure of that, is per capita income. Just the whole GDP of the country divided by the total population. But is it evenly distributed? It might be probably wealth for only one man, which we are distributing to the whole population. Now with this population census, to give us a clue how even the wealth is distributed. That's why there will be so many questions. They will even need to know how many, what wealth do you have. They will need to know whether you have a phone, whether you have a TV, whether you have a radio. So all that information is required for us to really understand. For us to really understand what type of population we have. Is this wealth evenly distributed? Are we all in the middle income status? Or it is just a figure. It is just a figure. So, and that's why I appeal to the whole population to cooperate with the enumerators. The census 9th, 10th, but it will continue. I think it will take about 7 days, because you cannot enumerate people in only 1 day or 2. And within 3 months, we shall have started getting the results of of that enumeration. But it is also now going to be more digital than manual, because now there will be no forms to fill. Everything will be digital. So the Uganda Bureau of Statistics has already imported the gadgets that are going to be used. So it will even be easier.
And that's all we had for you from our local stories. Now let's take a look at Today in History. Thank you for watching UCTV News. We are going to take a break, and don't forget that when we return, it will be time for the Rome Reports.
UCTV, good news for all.
Catch incredible stories of resilience, success.
You can manage that money
with a topping of inspiration.
Get interested in people, not interested in yourself.
Inspire, achieve, repeat.
You are watching UCTV, good news for all. For this and more, tune in to Kasese Get Radio 100.5 in Western Region, located at the hill of the Diocese of Kasese. KGR brings you all Catholic programs and an advertising platform in all our radio shows like Good Morning Renzori, Chama Towoka, Ukute, the business show, Propeller, the request show and sports, Evaluation, Bahinga Bakuluka, Late Night Show, and many others. Our other services include Isuzu Tipa, a no car, public address system, live band, Omokekera, an audio recording studio, and outside live broadcast. For more information, call 0773-597-166 or visit our website www.kasesegatradio.com. Kasesegat Radio, Omusondoria, the voice of truth.
UCTV, good news for all.
And that's all we had for you this Thursday edition of UCTV News. I'm Sunday Gloria Aboch. Good evening and good night.